Assalamualaikum and good morning. So for today's video, we are going to um, present the postoperative nursing management. So first, we're going to tackle is about the uh, postoperative nursing management, which is how the nurse taking care of the patient, which is the postoperative patient. How the nurse taking care of the patient very well. And then next, let's move on to the next topic or to our next topic. So here, or as you can see, we see in here the learning objective number one. So we are basing this on learning objective, which is 1 to 7 learning objectives. So in learning objective number 1, which is describe the responsibilities of the PACU nurse or the post anesthesia care unit nurse, which is in the prevention of immediate post operative. So first is we're going with which is the one who in charge, and this which is in the PACU is highly skilled nurses. And so the nurse's care focuses on re-establishing the patients. Maibabalik yung mga physiological equilibrium. Physiological equilibrium, ito yon. So, in the physiological equilibrium, kailangan mong maibalik yung lakas ng pasyente mo, which is you are giving your patient the correct medication. And you observe the patient or monitor the patient in every 15 minutes. That is responsibilities of a nurse. And also, you are giving or it is give, which is nabibigyan ng nutrients galing sa pagkain yung pasyente natin. Inshallah. And then, alleviating pain. And alleviating pain, we're going to have the patient through less the stress and have at least 8 hours of sleep. And then preventing complications and teaching the patient self-care. So by teaching the patient self-care, the nurse should inform to explain to the patient what he or she need to do and what to avoid. By telling them or the family members and friends who observe the patient, which is to avoid or should not drive vehicle, drink alcoholic beverages, and or perform tasks that require energy or skill. And also, the patient are cautioned not to make important decisions at this time. Kasi yung mga gamot and anesthesia and also surgery may affect their decision making. So, assess the patient to functional quickly and safety. Here, so assessing the patient functional quickly, safely, and comfortably, make sure that they are safe and comfortable. And through home care, the one or responsibility for that one is a professional caregiver. Okay, so we move on to the phases of post-anesthesia care. So we have the post 1 PACU or post-anesthesia care unit, and phase 2 PACU, and phase 3. So let's start from phase 1 PACU. So focuses on maintaining ventilation and circulation, monitoring oxygenation and level of consciousness, preventing shock or hypovolemic, yes, and managing pain. Then the nurses assesses and documents respiratory, circulatory, and neurologic function frequently. Then let's move on to phase 2, PACU. In phase 2, the patient is prepared for self-care or care in the hospital or an extended care setting so that will-be include the nurses, which is also the responsibility of the nurse to monitor the patient well. So let's move on to the phase 3. In phase 3, PACU, which is so this phase 3, here is the patient is prepared for discharge from the facility. And then, so the nurse should and check and make sure that the patient is in. But first, this is a PACU or the Post-Anesthesia Care Unit. So, dito nilalagay yung mga pasyente na galing sa surgery para maobserbahan or dito pinapagaling ang mga pasyente na gagaling pa lang sa operation or surgery. So in the phase 3, which is make sure that the patient is in stable vital signs. Okay? And then orientation, person, place, events, and time, and uncompromised pulmonary function, and then pulse oximetry readings indicating adequate blood oxygen saturation. And then urine outline at least 30 ml or millimeter per hour. Nausea and vomiting absent or under control. Kailangan dapat ma-check natin kung yung pasyente natin hindi nagsusuka-suka or nakakontrol na yung pagsusuka niya or hindi na talaga wala na tayong makikitang symptoms na ganong klaseng symptoms. And then minimal pain. So minimal pain yung hindi na masyadong masakit. We're going to ask the patient through subjective and objective. We're going to ask and we're going to observe the patient and ask the patient what she feels, if she feels pain and the wound in her or his wound. So let's move on to the next. So during the 24 hours nursing care of the hospitalized patient of a general medical surgical unit involves continuing to help the patient recover from the effect of anesthesia, frequently assessing the patients. So we're going to assess physiological status here, and then monitoring for complications. Yeah, nurses must do monitoring for complications of the patient. Yan. And managing pain. Yan, managing pain. And then implementing measures designed to achieve the long-range goals of independence with self-care. Yan. And then successful management of the therapeutic regimen and discharge to home and fully recovery. Still need to assess that. We're going to assess the patient, the responsibility of the nurse, and the PACU, also to discharge, from the PACU to discharge, yes. So in learning objective number 2, which is to compare post-operative care of the ambulatory surgery patient with that of the hospitalized surgery patient. So ambulatory surgery patient requires rapid response to high volumes of patients in a short span of time while dealing with issues that are not always predictable. And then the hospitalized surgery patient, which is this one. Yan. Hospitalized surgery patient, which is a surgical patients who requires hospital stays or trauma patients, acutely ill patients. Patients undergoing major surgery, patients who require emergency surgery, and patients with concurrent medical disorder. So let's move on to monitoring in every 15 minutes. So, number 15 minutes, we're going to monitor the patient and the PACU. Pupunta tayo sa PACU room and then we're going to check the pulse of our patient. The pulse of the patient, electrocardiogram of the patient, respiratory rate, blood pressure, pulse oximeter value or the blood oxygen level, and then end-tidal carbon dioxide or ATCO2. So we are going to check this every 15 minutes also.
Objective number 3. Learning objective number 3. Identify common postoperative problem and their management. Hemorrhage. Hemorrhage means bleeding, rapid loss from the sites of surgery. For example, can lead to shock. Treatment of rapid blood loss may include IV fluid or blood plasma, blood transfusions, more surgery to control the bleeding. The next, infections. One infection when the bacteria enter the sites of surgery. An infection can result. Infections can delay healing. Wound infection can spread to nearly all organs or tissue, all to distant areas through the blood stream. Treatment of wound infection may include antibiotics, surgery, or procedure to clean or drain the infected area. Deep vein thrombosis and pulmonary embolisms. Together, these conditions are referred to as venous thrombolisms. Term is used because the conditions are very closely related and because their prevention and treatment is also closely related. The next, pulmonary embolisms. Pulmonary embolism, the clot can separate from the vein and travel to the lungs. This forms the pulmonary embolisms. And the next, treatment depends on the locations and size of the blood clot. It may include anticoagulant medicines, thrombolytic medicines, surgery, or other procedures. Lungs, pulmonary. Complications. Sometimes pulmonary complications arise due to lack of deep breathing and coughing exercises within 24 hours of surgery. And the urinary retentions, temporary urine retention, or the inability to the bladder may occur after. And next, reaction to anesthesia. Reaction to anesthesia. All true rate allergies to anesthesia do occur. Symptoms can range from mild to severe. Treatment of allergic reactions include stopping specific medicines that may be causing allergic reactions. Also, administering other medicines to treat the allergy. And the next, pain. It seems obvious that surgery will be painful, but modern expertise with Kirlel and pain blocking techniques. And wound dehiscence. Wound dehiscence occurs when your wound comes partially or completely open against. This is obviously very upsetting and it can be shocking, particularly if an abdominal wound is involved. It is happened to you, then you should cover the open wound with a clean cloth and seek medical help urgently. And the next, lungs atelectasis. This is very common and involves a blockage and then a collapse. Atelectasis of the part of one of your lungs, usually at the bottom, so that it no longer fills the air when you inhale. It is particularly common after surgery to the tummy, abdomen, or the chest. Lung collapse occurs when the filter airways get blocked with trapped mucus. And the next, pneumonia, infection in the lungs pneumonia can occur after surgery. It is fairly commonly, although much less common than atelectasis. You may have a cough or abdominal pain, and you are likely to the hot and running at high temperature. And pneumonia often allows atelectasis and is treated with antibiotics. There are several things that you can do that will make you filter for surgery, making complications less likely. They include stopping smoking, weight control, good level of P test for AIDS, healthy healthy diet with corrections of and any deficiencies such as anemia, stopping any medications that you are advised to stop, and medications should stop. Follow the suggest Follow the surgeons and advice regarding preparation for surgery. Follow the instructions ab- about when to have you last food and drink prior to planned surgery.
The postoperative describe the gerontologic considerations related to the postoperative management. So, the gerontologic considerations, first monitoring the blood pressure and ventilation. So the older patient, like all patients, is transferred from the OR table to the bed or stretcher slowly and gently. So special attention is given to keeping the patients warm because the older adults are most susceptible to the hypothermia. So the patient's position is changed frequently to stimulate respirations as well as promote circulation and control. So next, immediately care for signs and symptoms are apparent. So immediately post-operative care for the older adult is the same as for any surgical patient. However, additional support is given if cardiovascular, pulmonary, or renal function is impaired. So with careful monitoring, it is possible to detect cardiopulmonary deficit. So, changes associated with the hanging process, the prevalence of chronic diseases, alterations of fluid and nutrition status, and the increased use of medications result in the need for post-operative vigilance. So the nurses should keep in mind that older adults may have slower recovery from anesthesia due to the prolonged time it takes to eliminate sedatives and anesthetic agents. Post-operative confusion and delirium may occur in up to half of all older patients. Acute confusion may pharmacokinetics of analgesic agents, hypotension, fever, hypoglycemia, fluid loss, fecal infections, urinary retention, or anemia. So next, reassess the doses of medications. So provide adequate
You may also need a
hydration,
small syringe to administer medications, cooled bottled water,
to
a
the
tablet crusher if needed,
environment, and
medications, a
reassessing
cup or glass,
the
and a
doses
medicine
of
pot, or spoon, or small
sedative,
glass. Now we will demonstrate how to
and
give a liquid medication.
analgesic
First, the
agent
tube using
may
50 ml
reduce
syringe
the risk
containing
of
recommended amount of
confusion.
cool
The
bottled water by your
hypoxia
dietitian.
can present as confusion and restlessness, as can blood loss and electrolyte imbalances. Exclusions of all other causes of confusion
Shake the medicine
must
bottle.
precede the assumption that
Measure the required amount of
confusion
medication
is
into the medicine
related
pot.
to age, circumstances, and medications. So next, assessing sensory limitations and maintaining safe environment. So dehydration, quantification, and malnutrition may occur post-operatively. For the sensory limitations such as impaired vision or hearing, and reduced tactile sensitivity frequently interact with the unfamiliar post-operative environment, so fall are more likely to occur. Maintaining a safe environment for other adults, so requires alertness and planning. So the arthritis is a common condition among older patients, and it affects mobility, creating difficulty turning from one side to the other, or ambulating without discomfort. So under the determining readiness for post-anesthesia care unit discharge, first, stable blood pressure. So a patient remains in the PACU until fully recovered from the anesthetic agent. Indicators of recovery includes stable blood pressure, adequate respiratory functions, and adequate oxygen saturation. Using Aldrich scale is used to determine the patient's general conditions and readiness for transfer from the PACU throughout the recovery period. The patient's physical signs are observed and evaluated by means of a scoring system based on a set of objective criteria. So this evaluation guide allows an objective assessment of the patient's condition in the PACU. The patient is assessed at regular intervals, and a total score is calculated and recorded on the assessment record. Before the signs and symptoms are a score of less than 7 must remain discharged from the PACU. The patients in the PACU until their conditions improves or until they are transferred to an ICU. So depending on their preoperative basement score, the patient is discharged from the phase 1 PACU by the anesthesiologist or CRNA to the critical care unit, the medical surgical unit, and the phase 2 PACU or home with a responsible adult. So in some hospitals and ambulatory care centers, patients are discharged to a phase 3 PACU where they are prepared for discharge. So next, preparing the post-operative patient for direct discharge. Ambulatory surgical centers frequently have a step-down PACU similar to a phase 2 PACU prior to discharge. The plan is to discharge them directly to home. So the patients will require verbal and written instructions and informations about follow-up care. So next, promoting home, community-based, and transitional care. So to ensure patient safety and recovery, expert patient education and discharge planning are necessary when a patient undergoes some day or ambulatory surgery, because anesthetics, good memory are for concurrent events. Verbal and written instructions should be given to both patients and adults who will be accompanying the patient's home. So, alternative formats of instructions or the use of a sign language interpreter may be required to ensure patient and family understanding. So, a translator may be required if the patients and family members do not understand English. So the last one, discharge preparations. So the patient and caregiver are informed about expected outcomes and immediate post-operative changes anticipated, identifies important educational point. So before discharging the patient, the nurse provide written instructions covering each of those points. So prescriptions are given to the patient. The nursing unit or surgeon's telephone number are provided, and patient and caregiver are encouraged to call with questions and to schedule follow-up appointments. Although recovery times varies depending on the type and extent of surgery and the patient's overall condition, instruction usually advise limited activity for 24 to 48 hours. So during this time, the patient should not drive a vehicle, drink alcohol, beverages, or perform tasks that require high level of energy or skill. So fluids may be consumed, are dissolved, and smaller than the normal amounts may be eaten at mealtime. So the patients are cautioned not to make important decisions at this time because the medications, anesthesia, and surgery may affect their decision-making ability.
Going to demonstrate on how post-operative dressing techniques. So today, I'm going to tackle all about wound care after the surgery, to clean dressing chains, on how to assess the patients. And usually, wound dressing and plaster should be changed daily for hygiene reasons. So the equipment, transport tape, paper tape, and medical tape. Perform hand hygiene and apply gloves. If you run advanced plasters that provides moist wound healing condition, it is recommended to leave in its place for up to 2 days or more in order to not interrupt the healing process. For open surgery, you will have strictly dressing over your wound, and open surgical wounds should not keep dry for 2 weeks. And carefully remove the dressing and apply hand hygiene and apply another gloves to clean this area, and apply surgical sponge to a patient carefully, and apply transport tape, and list down the date and time, and again perform hand hygiene.
Monitor vital signs and note skin warmth, moisture, and color. So the rationale is a careful baseline assessment help identify signs and symptoms of stuck early. Position the patient and enhance comfort, safety, and lungs expansion. So the rationale is this promotes safety and reduce risk of post-operative complication. Then the next is administering analgesic as prescribed and assess their effectiveness in the relieving pain. So the rationale is administration of analgesics help decrease pain. So provide information to the patient and family. So patient teaching help to decrease the patient and the family's anxiety. Position the patient and enhance comfort, safety, and lungs expansion. So the rationale is this promotes safety and reduce risk of post-operative complication. Then the next is place the cold light, emesis basin, ice chips if allowed, and the bedpan or urinal within reach. So the rationale is attending to these needs provide for the comfortable and safety. Reinforce the need to be a deep breath and leg exercise. So this activity help to prevent complication. Is assess urine output in closed drainage system or the patient urge to avoid the bladder distension. So the rationale is assess, provide a baseline and help identify sign of urinal retention. So reinforce the need to be a deep breath and leg exercise. So this activity helps to prevent complication. Assess pain level, pain characteristic, location, quality, in timing, types, and route of administration of last dose of analgesic. So the rationale is assessment provide a baseline is current pain level, and for the assessment of effectiveness of pain management strategy. And then next is assessment of the hospitalized postoperative patient, including monitoring vital signs, and completing a review of the system on arrival and inpatient to the clinical unit. So next is pulse, and then respiration. So respiratory status is important because pulmonary complications are among the most frequent serious problem encountered by the surgical patient. And then the nurse observed that the airway patency, watching for the legal edema, and the quality of respiration, including deep rate, the sound, are assessed regularly. Chest auscultation, verify that the breath sound are normal or abnormal. The nurse assess the pain level using the verbal or virtual analog scale and assess the characteristic of the pain. So the patient appearance, pulse, respiration, blood pressure, skin color indicate to the cyanotic, and then and skin temperature, cold or clammy, warm or moist, or warm or dry. So the clues to cardiovascular function. When the patient arrive in the clinical units, the surgical site is observed for the bleeding types of integrity of dressing and drain.